10 times the national average. And why? Because we chose clinics and developed clinics that had great mentorship. In the year 2000, only 1.7% of all graduates were going into public health clinics after graduation.
Wow.
When I left Michigan, 22% of our graduating class went into public health, 10 times the national average. And why? Because we chose clinics and developed clinics that had great mentorship and provided growth for those people after graduation. So they found out, try it, you'll like it, in non-traditional model sense, right? So now we expect to see the same thing happen in the DSO market. And that is, you know what, if you like an organization, I'm dealing with 6. I'm going to say this, you should have a different experience and different models to be selective, because many students try certain DSOs and they don't like it and they quit after 6 months. That's very disruptive to your growth. So I just want them to be aware and teach the model in the academic environment before they go out into the real world and see which one of those organizations is really working at the level that you want to be part of.
Why do you think the number is so low? Like you said, 1.7% nationally going to public health. Is that because there's a lot less money to be made?
That's not necessarily true as far as the money, because they're, now with loan repayments on the federal government side going into what I call dental desert areas, the money could be comparable, but most people do not select their practice opportunity on money. It's more or less on what's going to develop them professionally, okay? And I always say that nowadays, when I graduated from dental school, there was this perception that you were less than adequate dental provider if you went into a public health clinic. After reviewing those 117 doctors that I worked with, I can't even lick the boots off half of them, that worked in the public health sector. So that is total nonsense now. They're very, very, very professional, and they're very accomplished dental surgeons, if you will. So I just want to share with you, it's more about just saying, where is this growth model going to happen, to give the confidence, back to our students to go out and perform their daily duties. Because in the last 2 years, I have to tell you, the clinical services that our students provide has dropped immensely because of COVID. So I'm looking at ways that we could now boost up their productivity and gain their confidence before they graduate. And the DSO market really stepped up in that venue.